Hi, I don't know if you remember me, but I'm Dr. Hummel with National Bowen Therapy Training. We want to thank you for taking the advanced class. Larry Dickey will be doing the instructions, so you'll be able to remember all these moves. But I want to caution you, this is not a training tape, this is a memory tape, so that you'll remember the moves as they were presented to you. By now, you should have already accomplished your ability to do the moves. So with that, no further ado, we're going to present Larry Dickey doing the advanced Bowen therapy training.
The first move we're going to do is called the Bowen hug, or the optional move. You're going to have your clients pigeon toe their feet or pointed together, have them put their arms around you. You're going to reach around, have them stick their buttocks out. You're going to start at the coccyx. You're going to take the slack down, move up at an angle, slack down, move up, then just walk it up at an angle. Start back at the starting position and just repeat, slack down, move up, and walk your way up. At the completion, have them stand straight, put their feet shoulder width together, straight, have them get in the same position. You're going to start at the lower lumbars, same thing, slack down, move up at an angle, slack down, move up, and just walk right up to the lower scapula. Starting position, slack down, move up, slack down, move up. And at the completion, have them stand straight, put their toes back together, have them lean in. You're going to get right into the SI joint, just make a little circle there. Go out on the hips, take the slack down and in, come down in position on the SI. You're going to take the slack down, move up, slack down, move up. And that completes the Bowen hug. Next we have the advanced torso move. We're going to find the top of the iliac crest. We're going to be about midline. We're going to use our fingers and take the slack all the way out to the iliac crest, and the move is in, very lightly. We come across with our thumbs, slack towards the iliac crest, challenge, move inward. Move down an inch, take the slack out to the ilium, and the move is in. Cross the other side, slack out, move in. Wait 2 minutes. Next, we find the navel. We're going to take the slack out, challenge, move in. Slack out, move in. Next, we alternate. We're going to bring the slack in, move out, slack in, move out. We alternate. Slack out, move in, slack out, move in. We alternate. Slack in, move out, slack in, move out. And we alternate. Slack out, move in, slack out, move in. Wait 2 minutes. Next, we go right in between the bust, using your finger on the outside lateral border of the sternum. We're going to take the slack out, move in, take the thumb on the opposite side, slack out, move in, go up an inch, slack out, move in, opposite side, slack out, move in. Move up underneath the clavicle, using the thumb. You're on the outside part of the sternum. You're going to take the slack towards the sternum, move out. Slack in, move out. Slack in, move out. Come across, slack in, move out. Slack in, move out, slack in, move out. Next series is right below where we just worked. You're going to take the slack towards the sternum, move out, slack in, move out, slack in, move out. Come across to the other side, slack in, move out, slack in, move out, slack in, move out. And that completes the advanced torso. Advanced abdominal disorders. First, we're going to find the top of the clavicle, close to the sternum. We're going to sink our finger in, hook underneath, take the slack in, move out. The opposite side, sink in, slack out, move in. Next, we're going to come down to the top of the pubic bone, and we're just going to make a circular motion. Wait 2 minutes. Next, we're going to be midway between the navel and the ilium. We're going to make clockwise motions. And we're going to take the slack towards the ilium, and the move is towards the navel. Come to the opposite side, make a circular motion, slack towards the ilium, move towards the navel. Find the curve of the rib cage, be out about 1 inch. You're going to take the slack towards the rib cage, move towards the navel. Same thing on the opposite side, slack towards the rib cage, move towards the navel. Find the xiphoid process, be about 2 inches inferior of that. Take the slack up towards the xiphoid process and move is down. And that completes advanced abdominal disorders. Next, we have the vagus nerve release. We're going to take our index fingers, place them right on top of our clavicle, and let that sink in, and you're going to take the slack towards the clavicle, sternum, and move out. Opposite side, slack in, move out, slack in, move out, slack in, move out, slack in, move out, slack in, move out. Next, we come down to the top of the pubic bone. We start at midline. You're right on the upper edge. You're going to take the slack towards midline, move out, slack in, move out, slack in, move out. Come across, same thing, slack in, move out, slack in, move out, slack in, move out. Come across, reach up underneath her armpit. You're going to take the slack across the teres muscles, take the slack towards the back, and the move is out. Opposite side, slack in, move out. Lower yourself on the latissimus dorsi, slack in, move out, slack in, move out. And that completes the vagus nerve move. Advanced breast and lymphatic drainage. We're going to repeat as we did in the basics. We're going to bring our hand at an angle, press the bust line down, come in with the opposite hand with the index fingers together, take the slack down, across the pec, move is up. Now we're going to straighten our fingers, keep the slack down, the breast down, take the slack out, move up, midline. We're going to come below, press the breast up. With your index fingers, you're going to bring the slack towards midline, and the move is out. We're going to repeat on the opposite side. We're going to press the breast down, take the slack at an angle, and the move is up and across. The move is straight across, come back to midline, press the bust line up, take the index finger, the slack is in, and the move is out. Now, we're going to come across to the top of the bicep. We're going to take the slack in, and the move is out. The slack is in and the move is out. Come around, we're going to get underneath. We're going to take our hands at an angle. We're going to angle it up towards the spine and the move is down. Slack is up at an angle and the move is down. And that completes the advanced breast and lymphatic drainage move. Psoas release move. I'm going to bend the knee to loosen the abdomen. I'm going to find the navel, move out approximately 1 to 1/2 inch. I'm going to have her inhale. Using my middle finger, I'm going to sink down in until I find the fibers of the psoas, which I just found. Now we're going to use the BTP move, which I'm going to take the slack down, up, down, and around, and make the move inward. I'm going to move down a notch. I'm going to take the slack down, up, down, and around, and make the move. Next, I'm going to lower the leg. I'm just going to make this little gentle move across the inguinal ligament slightly above it. I'm going to walk around, raise the opposite knee, come in at the navel, come out an inch, inch and a half, have them inhale and exhale, and with your middle finger sink down in until you find those fibers. And you're going to take the slack down, up, down, and around, make the move. Move down approximately 1 vertebrae, take the slack down, up, down, and around, and make the move. Lower the leg, come in, take the slack towards the pubic bone, across the inguinal ligament, and wait 2 minutes. After 2 minutes, we're going to put our hand at an angle on the iliacus muscle. We're going to bring the leg out, and as I bring the leg in, that pops that iliacus muscle right across. Walk around at an angle. Let's take the slack in, the leg is out. As I move the leg in, you make the move. Lower the leg, bring the leg up, and just do some circumduction both ways. Let it process 2 to 5 minutes. That completes the psoas move. Next we have the large intestine procedures. We're going to have a bolster under their leg, find the top of their iliac crest. We're going to be level with that. We're going to have our hand straight down. We're going to sink in. We're going to do the BTP move, where we're going to take the slack down, up, down, and around, and the move is towards midline. And we're just going to follow the colon all the way up. Now we're going to come across doing the same procedure. Now the only difference now, since we crossed midline, the move is done midline, so it'll be the opposite way. And that completes the large intestines move. Advanced shoulder neck procedure. We're going to find the top of the shoulder, come down about 3 inches through the posterior middle deltoid there. We're going to take the slack back, move across. Reach around up underneath the armpit, underneath the tricep, take the slack in, move out, slack in, move out, slack in, move out. Walk in front, reach up underneath the armpit, take the slack across the teres muscles, take the slack back, move across the latissimus dorsi muscle, slack back, move across. Reach around the back, find the lower part of the trapezius muscles, take the slack down, move up, slack down, move up, slack down, move up. Repeat on the other side. And this ends the advanced shoulder and neck procedure. Pain under scapula move. Let's go ahead and have them grip your thumb, bring and relax on the opposite shoulder, open up the scapula. We're going to take the move right along the border of the scapula. Take the slack up, move down, slack up, move down, slack up, move down, slack up, move down, slack up, move down. Any areas that there's pain, go ahead and do the BTP move, where you take the slack down, up, down, and around, and release. After that's completed, go to the lower trapezius muscles, take the slack down, move up, slack down, move up, slack down, move up, slack down, move up, just to the lower shoulder blades. And that completes the pain under the scapula move. And repeat on the other side. Next we have the relaxing arm technique. We're going to come to the elbow and we're just going to make little Bowen moves around the elbow. And we're going to just come across all four corners of the elbow. Relax their arm. We're going to take both hands and we're just going to split the tricep. Nice little Bowen soft moves all the way down the tricep and the forearm. As you complete, we come up to the top of the bicep and we just slack out or moves out, just separating, just relaxing the arm all the way down the forearm to the wrist. Complete on the other side, and that completes the relaxing arm procedure. The next procedure we're going to do is the deep paraspinal and shoe point procedures. We're going to start, I use a little tool, I'm going to be down next to the coccyx, I'm going to get into the deep paraspinals along the lamina groove. I'm going to take the slack down, move up, slack down, move up, slack down, move up, slack down, move up, slack down, move up. You work your way all the way until you reach L5. Walk around and complete on the other side. Slack down, move up, slack down, move up, slack down, move up, slack down, move up till you reach L5. Wait 2 minutes. Then we're going to start right at the lumbosacral junction. We're going to do the same procedure. Thumb above the tool, slack down, move up, 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 till you hit that 12th rib. Walk around. Same procedure at the lumbosacral junction. Take the slack down, move up, slack down, move up, slack down, move up, slack down, move up, slack down, move up till you hit that 12th rib. Wait 2 minutes. We're now going to work the thoracic region. We're going to be roughly at T12. Same thing, slack down, move up, and you're just going to work your way up the spine, depending on how compromised they are. I go to mid-thoracic burl line. Walk around. Start at about T12, take the slack down, move up, 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 slack down, move up to about the brow line. Wait 2 minutes, and we'll complete the upper thoracics. Going to take the slack down, move up, slack down, move up, slack down, move up, slack down, move up. We're going to go to approximately T1. Back down, move up, walk around, starting position. You're going to take the slack down, move up, slack down, move up, to approximately T1. But that process for 2 minutes. This completes the deep paraspinal shoe move. Deep paraspinal optional procedure. We're going to start down on close to the tailbone like we did before. We're going to use the BTP procedure and be out more lateral this time. We're going to take the slack down, up, down, and around back to midline. Work the opposite side, down, up, down, and around towards midline. And we're just going to alternate our way up. Until we hit the lumbosacral junction. Wait 2 minutes. We're going to do the same procedure, except we're going to be on the lumbars. I'm going to take the slack down, up, down, and around, move midline. Slack down, up, down, and around, midline. Alternate each procedure on each vertebral segment. Down, up, down, down, and around. Down, up, down, and around. And we're going to do this until we hit the thoracic region. Wait 2 minutes. After 2 minutes, we come to the thoracic region, and we're going to alternate our way up. Down, up, down, and around. 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 Down, up, down. We're going to do this all the way up to T1. At T1, wait 2 minutes, have your client turn over. Then we're going to work each segment of the cervical. We're going to start low and work high. We're going to be right around C7. We're going to go slack down, up, down, and around. Slack down, up, down, and around. Using the middle finger, slack down, up, down, and around. Down, up, down, and around. Work all the way up to C1 if you can, or C2. And that completes the deep paraspinal and shoe points. Deep sciatica and posterior tibialis. We're going to find the head of the femur. We're going to place our thumbs in there, or you can use your fingers. You're going to take the slack down, move up. You're going to just slack down, move up, and just work right around the gluteal muscles till you come across the sacrum. Come down, raise the leg, abduct it. Take your hand, you're going to come across the hamstrings and the adductor, and as you make the move out, move the leg across. Lower, walk around, and do the other side. Slack down, move up, slack down, move up. Make sure you're using a semicircle move until you come across the sacrum. Come across, bring the leg up, abduct it, take the slack down, and as you make the move, bring the leg across and lower. Wait 2 minutes, come across, you're going to be next to the tailbone. You're going to have your thumbs right next to it. Take the slack down, up, down. Get as much tissue as you can, and the move is down. Slack down, up, down and around. Get in as much tissue as you can. Move across. Wait 2 minutes. Come down. You're just going to split the calves. Medium to firm. After 2 minutes, you're going to raise the leg. You're going to find the mid part of the calf where the soleus attaches, and you're going to make little circular moves. Or you can crisscross it, or you need to make that BTP move. After that loosens, you're going to come out on the posterior tibialis. You're going to take the slack towards the midline. Move is out. Slack in, move out. Slack in, move out. You can do this 3 to 4 times. Move out. Walk around. Raise the leg. Find the middle of the calf. Find that tender spot. You're going to loosen that up in a circular manner, or you can crisscross it. You can do a PTP move. Come out. You're going to take the slack across the tibialis posterior. Move across. Slack in, move out. Slack in, move out. Slack in, move out. Lower leg. And that completes the deep sciatic and posterior tibialis moves. Advanced pelvic move. We're going to take our superior hand and slide right up the thigh as far as you can go. Take the opposite hand, get in there, and we're going to take the slack in and under the adductor magnus. As that softens, you make the Bowen move. Come straight down to the attachment of the adductors, right across the knee. Take the slack down. Move towards midline. Walk around. Slide your hand right up the thigh as far as you can go. With both hands, you're going to take the slack down, up, and under. Challenge. Make the move. Slide your hand down across the attachment of the adductor on the knee. Slack down. Move up and across. Wait 2 minutes. After 2 minutes, we're going to start low on the IT band. We're going to take the slack down, move up roughly 3 inches, slack down, move up 3 inches, take the slack down, move up across the IT band, move up about 3 inches, take the slack down, move up. We're going to come up and across the tensile fascia lata. We're going to take the slack towards the table, challenge that muscle, make that move across. Walk around and complete on the other side. Right on the IT band, take the slack down, move up 3 inches, 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 slack down, move up. Come up across the tensile fascia lata, take the slack down and challenge across the muscle, move up and across. Wait 2 minutes, and that completes the advanced pelvic. Advanced shin moves. We're going to come out on the outer part of the calf here, or the shins. We're going to take the slack down, up underneath the muscle, make the move. Move down approximately 1 inch. Take the slack down, up and under, make the Bowen move. Move down about 1 inch, take the slack down, and make the move. Move down about 1 inch, slack down, make the move, and the lower one, slack down, make the move. Come back up, more midline, you're going to be right along the anterior tibialis. You're going to take the slack out, move in and across, slack out, move in across, slack out, move in and across, slack out, move in and across. And the last one will be a little lower, slack out, move in across. We're going to reach over, and we're going to do the same thing across the calf there, and the muscle going to take the slack down and up, move across, slack down and move up and across, slack down, move up and across, slack down, move and across. And that completes the advanced shin move, and complete on the opposite side. Vastus lateralis and sartorius move. We're going to come up at the inferior part of the ilium here and find the attachment of the sartorius. We're going to take the slack out, move in and across. Go down roughly about 3 inches and find the meaty part of the sartorius. Take the slack in, underneath, make the move across. Now just follow the sartorius muscle all the way down. Take the slack down, underneath, hold, and make the move. Down, underneath, hold, and move until you reach the knee. Complete on the opposite side. Wait 2 minutes. We're going to come up here at the top of the vastus lateralis. We're going to take the slack down and then move up and across. Slack down, get up underneath that muscle, and make the move across. And work your way down. Slack down, move across. Slack down, move across. Until you go right above the knee. Move and complete on the opposite side, and that will complete the vastus lateralis sartorius move. Advanced TMJ procedure. Going to have them place the finger between their teeth without biting. I'm going to place my finger right in front of the ear, move out slightly, just like you would in the basic. I'm going to take the slack towards the ear, back, slack up, and back to starting position. Go to the opposite side, take the slack towards the eye, move back. Come back to starting position, move up, slack up, move down. Come in behind the ear. I'm going to take the slack up, move down, slack up, move down. Now you're going to have them move their jaw to the right. I'm going to do the same thing, slack up, move down, slack up, move down. Move the jaw to the left, complete the same, slack down, move up, slack down, move up. Go back to neutral and repeat. Now you're going to find their cheekbones. You're going to bring the slack down, move up, slack up, move down, 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 slack up, move down. have them remove their finger, let them process for 2 to 5 minutes, and that completes the advanced